Bulaganaka, and welcome back to another episode of our cancer awareness series. I'm your host Priscilla, and today we'll be talking about something that affects many men here in the Pacific, and that is prostate cancer. With the right information and regular checkups, prostate cancer can be detected early and treated effectively as well. Joining us today is Dr. Rubaganesh, our urologist here at Oceania Hospitals, who will be helping us understand what prostate cancer is and also what kind of signs to look out for the men here who are viewing our podcast here today. So we'll kickstart with the questions. So Dr. Ruba, we'll start with the basics. What exactly is the prostate, and why is it so important for men to understand how it works?
Yeah, so prostate gland is one of the main part of the urinary and the reproductive tract in men. So when I say about the urinary tract, okay, so make it simplified. So this is the urinary bladder, and this is the tube through which the urine comes out in men. Okay, so and this is your pee hole. So this is how the anatomy is. The prostate is situated right at the junction where the tube joins with the bladder. So it's like a donut which chokes the passage. So this is how the prostate, by its situation, causes symptoms, and also it is part of the reproductive tract. The semen and the testicles need to ascend through a very small tube, and it joins the urinary system through the prostate. So the prostate is at a confluence where the urinary system and the reproductive system joins in the male anatomy.
Naka, so what are some of the warning signs or risk factors that men should look out for when it comes to prostate cancer?
Yes, so prostate cancer as such is a disease of the elderly men. So whenever you are a man who is beyond 50 years of age, so you need to undergo regular screening by a urologist, ideally, to look out for any signs of prostate cancer. So it is going to be a clinical examination where we examine the prostate through your natural orifice, that is the butthole, and to see if the prostate is having any nodularities. Nodularities means any bumps in the prostate, or if the gland is hard to feel. So these are the signs which we pick up when we do a clinical examination. And also we run a blood test called the PSA. The PSA stands for prostate specific antigen. It's a blood test which is very available across most of the hospitals, where you can get your prostate antigen checked. If it is elevated, then you need to again get back to the urologist to do further investigations to see for the prostate cancer.
Okay. So we know a lot of men tend to avoid getting screened. Why do you think that is, and what would you say to encourage them to get that checkup, to take that step?
Yeah. So the problem with men, especially elderly men, is they try to neglect their own health. So this is kind of a thing which is prevalent across the world, especially men who have been career oriented, who have been working hard in their profession, usually try to neglect their own health. So it's basically a kind of a self-awareness in the sense that we know that we are going to age. We know that we will be facing problems, especially regarding our health when we age. So we need to be more vigilant. We need to be more alert in knowing what's happening with us. If you have any symptoms related to any organ, like if you, especially in the prostate, if you have any symptoms of difficulty in passing urine, if you have any burning sensation while passing urine, when you find there is something like amiss in your daily activities, you need to go to the hospital, get a consultation first from the general practitioner, and also get a master health check done, so that these cancers, especially the prostate, can be diagnosed early.
Right. So on that note, what kind of prostate screening and diagnostic services does Oceania Hospitals offer to help men stay on top of their health?
Yeah. So at Oceania, we have very good radiology services available. So whenever we see the patient, we first examine them clinically, first by the general practitioner, and then if they required, they send to the urologist. So I will do the examination of the prostate. Then I will be asking for a blood test, which I already told that's the PSA. Then if the PSA is elevated, then we will can get the MRI scan of the prostate to see for any malignancy in the prostate.
Laka, so finally, what's your message to men and their families about taking prostate health seriously and getting checked early?
Yeah, basically it's the awareness. Like you need to be very vigilant about your own health. You need to get to the hospital whenever you are having any kind of minor ailment, especially when you are above 50. It's better to get a routine annual health screen done at the hospital so that you can pick up symptoms. We can pick up the problems like especially prostate cancer in the earlier stages. So when you diagnose it early, then the chances of cure is more. Then you can prevent the disease from getting into the advanced stage. So it's better to consult, especially the general practitioner at your hospital, to first know what's kind of wrong with you, so that you can get to the next stage of consultation, that is with the urologist. So we will do a detailed examination and we will advise you accordingly.
So that brings us to the end of our Cancer Awareness Series episode. To our viewers, be sure to like, subscribe, and follow. Share the podcast today to spread awareness on prostate cancer. And a big vinakamakaliv to Dr. Ruba for sharing his valuable insights. To our family members and to the viewers, please encourage men in your community to take that step and getting themselves screened. Until next time, stay healthy and take care.